Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about osteomyelitis. Osteomyelitis is an inflammation of the medullary portion of the bone. When the medullary portion of the bone is inflamed, it is known as osteomyelitis. The word osteo means bone. The myelitis, itis, which is known as inflammation. When the medullary portions of the bone is inflamed, it is known as osteomyelitis. What is the etiology? The etiology is periapical infection. Any periapical infection, when the any portion periapical infection which enters into the bone marrow and form that it extends into cancellous bony spaces. Enter into the bone marrow. When the periapical infection enter into the bone marrow and forms there and it extends into the cancellous bony spaces. It is this etiology is based on the oral cavity. When there is periapical infection or other foci, it enters into the bone marrow. Periapical infection means infection in the root portion of the tooth. Enters into the bone marrow and forms and extends into the cancellous bony space. The occlusion of the nutrition vessels of the living bone thrombus formation is seen. The thrombosis of the nutrient vessels and the excessive pressure from the inflammatory exudates against the rigid and confined space in the bone. The thrombosis of the nutrient vessels and the excessive pressure from the inflammatory exudates against the rigid and confined space in the bone. The disturbed nutrition supply to the bone cells. Death of the cancellous bony trabeculae, sequestrum formation, spread of infection to the Waxman canal plates to reach the external surface of the bone below the periosteum. These are the etiology. It enters into the bone marrow and forms and extends into the cancellous bony spaces. After it enters into the bone marrow, it extends to the cancellous bony spaces. The occlusion of the nutrient vessels of the living thrombus formation is seen. The thrombosis of the nutrient vessels, excess pressure from the inflammatory exudate against the rigid confined spaces bone. There is disturbed nutrition supply to the bone cells. Death of the cancellous bony trabeculae is seen. Sequestrum formation is seen. Spread of infection to the Waxman canal plates reaches the external surface of the bone below the periosteum. This is the etiology. From there is inflammation of the periosteum causing periostitis, where the periosteum gets inflamed, and the accumulation of the exudate and the pus in between the periosteum layer. When the periosteum layer gets inflamed, there is accumulation of the pus seen. Separation of the periosteum from the cortical plates are seen. Necrosis of the cortical bone is seen. When the periosteum gets inflamed, the pus and the exudates are inside it, and due to that, there is separation of the periosteum from the cortical plate, and this leads to the necrosis of the cortical bone. This is the etiology of this osteomyelitis. Treatment is conservative treatment and surgical treatment. These are the two treatments which is done in the osteomyelitis. The conservative treatment is complete bed rest, supportive therapy, dehydration control, blood transfusion when the RBCs and HB is low. When the RBC, which is red blood cells, and the HB hemoglobin is low, the blood transfusion is done. Dehydration is controlled. Intravenous antimicrobial agents like penicillin is given. Due to this, it occurs due to the periapical infection. There is gram-negative bacteria is present, so that the penicillin is given for antibiotic. Surgical treatment, antibiotic cover leaves for 1 to 2 days before the procedure. There should be antibiotic should be given for the patient who is going to undergo surgery for 1 to 2 days before the surgery. And done as soon as possible. The extraction is loose or offending teeth. Sequestrum is formed should be removed, and it can be gently picked up. The sequestrum should be removed as it should be gently picked up. Intraoral drainage can be established from the body of the mandible. Intraorally, we should drain all the pus which is in the sequestrum. Thank you. That's all about the osteomyelitis. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. Thank you.